Wow, wow, powerful stuff there for sure. And what we want to talk about here as well, and the questions that they may have regarding the sleep apnea is now, what about our veterans who do not have a CPAP machine yet,
Mm,
right? So, there's a lot of times where they may go in, do a sleep study, and the results are inconclusive, or
mhm,
they may be told that it's not severe enough to warrant a CPAP machine. However, the wife is complaining about snoring. The wife is worried about, and you're worried about as well as the veteran, not breathing while asleep, and different symptoms that you're
mhm,
experiencing. However, your physician is saying, hey, based on the sleep study, we're not going to fund you receiving a CPAP machine or even recommend it. What
mhm.
would you say for those veterans dealing with that?
Well, I mean, first and foremost, get a second opinion. Get a second opinion. If you feel as though that again, that your diagnosis, your symptoms, your issues that you go through on a day-to-day basis is at a higher level than someone else's opinion, even though it's a medical opinion, it could be again a professional opinion. You always want to go ahead and shop around, right? You don't buy the first car that you get in, do you? Well, if not, or if you do, still go shop around. You want to go get a second opinion, just due to the fact that opinion may not be the best for yourself because, as we know, when we go to the VA, we get our treatment, and once we're getting our treatment, a lot of times, unfortunately, some veterans are not put in position to have their care um, delic- delicately provided to them. Okay. A lot of times it could be just in and out. And it's an unfortunate situation. It happens again when we're talking about that physician. That physician is probably seeing 100 veterans that day, and it just may not be enough support. So, with that said, you might want to get a second opinion. And if you're not receiving the care you need, you might want to receive other care, which you can be able to provide. We'll be able to provide you a lot more information in the community in receiving secondary opinions and care. And we're not talking about, any type of quick care clinics or anything of that nature, or any type of medical evidence that you may need for your case file. We're talking about strict medical treatment.
So it's
So, with that being said, uh, getting your second opinion and getting additional care is going to be able to support your case file. But um, I'll tell you this: we know sleep apnea has been very prevalent amongst the military community. We know if you are dealing with things of that nature. So, with that being said, make sure you are taking the time to be able to get your case file developed. All right. Get your case developed. Okay. A lot of people don't understand that this is a binding case that they will be reviewing for approval or disapproval of benefits. So take your time to do what you need to do correctly. Or would you rather wait to be granted than be quick to be denied? Right. So make sure you just really take the time to get that in because of the updated changes that are coming around. However, we understand that we are it seems as though that they're shrinking the number of veterans who are being able to get sleep apnea. So criteria gets more difficult in a lot of components. So I want you guys to know that a lot of changes are coming. The VA is making a huge overhaul, and we're here to make sure that you get all the information that you need and that you deserve.